An economist is someone who focuses on the economics of health and healthcare. Now, in the UK, a health economist can work for different institutions or bodies. So there are health economists working in academia and universities, doing research on the value of healthcare. There are health economists that work within the NHS for primary care trusts. Health economists are also employed within the pharmaceutical industry as well, to provide information on the value of their new drugs. So that's a challenge that's not specific to genetic tests, because all the time drug companies are bringing new drugs to market that are supposed to be innovations, so they're something new to healthcare. The challenge with genetic tests is how you value the benefit to the patient. For most healthcare interventions, the aim is to either modify disease progression or halt disease progression. So you're aiming to cure someone. So you're aiming to add years of life to someone, so life years gained. Now those life years gained might be in pure health, so perfect health, or you might need to think about adjusting the quality of those extra years of life. So if you're talking about medicines, you look at the value of the medicine in terms of whether it improves your health status compared to not having the medicine. Now, for a genetic test, it might be that you use a genetic test to diagnose a condition for which there are no current treatments. So the value of that genetic test might not be in terms of improving years of life, because you don't actually cure the condition. The value of that test might be in terms of additional information, so the value of knowing. So it potentially is a problem to compare something like a genetic test where the value is about information compared to something that actually adds years of life and quality of life. At the moment, if you were looking within the UK, NICE would say we need to use a measure that looks at health status. Now, measuring health status might not be relevant to a genetic test. So that is a challenge for health economists to think about how we look at the value of these genetic tests so that we can compare their value to the value of other treatments. The way healthcare evolves, healthcare has evolved at the moment, is that there are genetic tests available for single gene disorders, and that's provided as part, again referring to the UK, as part of the healthcare system, so within the NHS. Now, going back to what I was saying just before about looking at the value of genetic testing, that there might be an argument that well, we should not be providing genetic tests as part of a healthcare service because they don't actually improve health status. So if you think about the budget for healthcare being about improving health status, well, genetic tests don't actually meet that objective. So I mean, I don't agree with this, but one option might be to say, well, let's take genetic testing outside the remit of a national healthcare service, so that people do have to pay for testing themselves. Well, that was obviously going to be changing what current practice is at the moment, in that there are genetic tests available on the NHS. I think your question might be alluding a little bit to sort of direct-to-consumer testing that's available, particularly well, on the internet. To me, they're a different category of tests. They're not there specifically to try and aid healthcare decision making. They're more for use at a personal level. So I think we're coming to a point where we have to think about carefully how we categorise genetic tests. What do we mean by a genetic test, and what is the purpose of that genetic test? I think they should do. I think it's important that it is within the remit of a healthcare service where you have appropriately qualified and knowledgeable individuals telling you about the value of these tests and how you could possibly act on the information from these tests. So I think it's important that they do stay within the remit of the healthcare service. The issue does become about funding, because obviously the healthcare is provided from a finite budget, so there has to be a point then about making decisions about which tests are funded and which are not. And that's when we come back to the issue of how you show the value of these tests. What is the added value compared to other approaches to management and treatment? Yes, I think in an ideal world, I think the challenge, particularly in the UK, and I'm sure for the rest of the world, is about the capacity, the informational requirements. At the moment, we have a system of recording your healthcare in sort of medical notes within the UK. So your medical notes will be held within a hospital, and so obviously you have to think about how that information follows you through your life, and that to me, as I see, is the main challenge, because you have to think of the transferability of that data, and also taking it through your life, people being able to interpret it and it still being relevant in 20 years' time.